Workup of epistaxis. When a patient presents with a nosebleed, start by asking a few key questions. Are they on any blood thinners? Was there any trauma involved? If so, be on the lookout for possible nasal or facial fractures. From there, labs may include a CBC and possibly an INR and PT. Evaluate for underlying causes such as a bleeding disorders in recurrent or severe cases. A simple nosebleed do not require lab work. There are two main types of epistaxis, anterior and posterior. Posterior epistaxis carries higher risk, not just for bleeding, but for airway compromise. These can cause asphyxiation from blood trickling down the airway and can even trigger bradycardia due to vagal stimulation. Epistaxis treatment. First, apply firm, steady pressure to the soft part of the nostrils for 10 to 15 minutes continuously. If bleeding persists, insert oxymetazoline-soaked gauze into the affected nostril and reapply direct pressure. Once you've got it under control, take a look to see where the bleeding is coming from. Most of the time it's anterior, from Kieselbach's plexus, but sometimes it's posterior, which is trickier. Next step, have the patient blow out any clots and get your nasal packing materials ready, whatever is available, such nasal tampon or balloon. If you end up placing nasal packing, don't forget to prescribe a prophylactic antibiotic to prevent sinus infections or, rarely, toxic shock syndrome. And for the tough cases, call ENT. You'll definitely want to consult for any posterior bleeds, recurrent episodes, or if you had to pack both sides. These patients usually need to be admitted for observation.